Good afternoon, everyone, and welcome to Primetime at the Bethel University Library. Primetime is a collaboration between the Friends of the Bethel University Library, Academic Affairs, and other offices on campus, and celebrates learning in and beyond the classroom of Bethel faculty, students, and staff. We archive videos of past presentations. If you'd like to explore them, you can find them on the Bethel University Digital Library YouTube channel or in the Spark Digital Archive. Thanks for joining us for our last Primetime of the fall semester. Be sure to watch the Bethel e-announcements for upcoming Primetime events. Today we're welcoming Julie Haan, Professor of Nursing and 2023 Faculty Excellence Award winner in teaching, as she shares the findings from the literature and research conducted for her dissertation and provides practical ways to create, evaluate, and revise exam items to improve item and exam statistics so that exams are strong and fairly constructed. Let's welcome Julie.
Well, thank you, Ray. I forget that most people haven't spent hours and hours reading all the articles about this. So I'm excited to talk about it because I could talk for a long time about creating really fair test items and why it's so important. So that's the real reason I want to start here is why this topic? Why do we need to talk about the fairness of multiple choice exams? In nursing, it's a big deal. They have to reach this exam average of 75% in order to progress to the next semester. And if those exam items aren't created fairly and aren't statistically valid, then it isn't a fair evaluation of our students either. So when I first started teaching in one of our major didactic courses, I had so little, almost none, experience writing exam questions, and then I had to start writing these high stake questions for students, and that's what started this whole journey. We use multiple assessments in the nursing department. It's just one of them is a multiple choice exam. But at Bethel, I know that there are a lot of departments that say you have to maintain a 3.0 average in order to progress to, and I have no idea how many multiple choice questions are part of their assessments. But if they are, it's important that they are fairly constructed and fair to the students. So, like with my own career, I worked in the hospital setting for over 20 years and then moved into academia. No opportunity to write multiple choice questions. My master's degree is in nursing education, and we talked about it a little bit, but again, not a lot of practice in writing questions. And that happens a lot with people who become academics, right? They don't get a lot of training on how to write excellent multiple choice questions. They're experts in their field. Like, I know a lot about nursing, but I didn't know a lot about writing test questions. So research showed that because of this, there are a lot of flaws in those multiple choice questions. I have a lengthy biography or reference list if you'd like to look at some of those articles as well. So again, this does not set students up for success and can actually perpetuate some false content ideas if construction of exam items isn't high quality. So many different practicing educators have talked about what are best practices for writing exam items. So when I started my research, I started to look at people from not only nursing, but from biology and from pharmacy and from physical therapy and from med school to see what they said the best practices were. A lot of them were overlapping, but I compiled a list that I felt was really a good list that represents people from across disciplines and not just one or the other. And then in my research, I also sent out a survey to over 250 nursing educators from across the United States and asked them, these are the best practices identified in literature, and how frequently are you using them? And the use of them was really infrequent. So I asked about the barriers, what would make it easier for you to use these, what else would you need in order to become a better proponent of best practices, and the common answers occurred, right? It's time and lack of educational opportunities and things like that. So we in the nursing department worked really hard. This is also part of my work on my sabbatical, was to create a nursing testing guidelines document, and I'll talk more about that in a minute. So best practices for exam construction really involve 3 different areas. One of them is pre-exam planning, the other is item creation, and the next is that item evaluation and revision based on your statistics. So we're going to walk through all 3 of those. So as I mentioned, these are, this is goodness, words are hard some days. This is the table of contents. That's what it is. This is the table of contents. It's right there for our exam testing policy or guidelines. So these are all the things that we have listed in our guidelines to help our new faculty especially figure out how do we write good, high quality exams. It is linked in my PowerPoint, and if you are interested, I also brought a couple paper old-fashioned copies if you'd like to take a look at those as well later. But this helps promote consistency across our department. Everybody is expected to write exam questions that are of a specific caliber and quality in order to make sure that we are testing our students fairly and adequately across the curriculum. And as I mentioned, this is a really excellent guide for new faculty because it goes into a lot of detail, and we'll talk about that in a bit. So pre-exam planning, we have faculty develop a blueprint, and the blueprint not only aligns with the learning objectives for that module and the course content, but it also signifies how are we going to weight these across all of our content days, how are we going to, what types of questions are we going to use, what is going to be fair and consistent for our students, and these blueprints also begin to help students then study for their exams, and I'll give you some examples of those as well. So common components of the blueprint beyond those I mentioned already is, we're going to talk about, like we just gave an exam yesterday on the GI system and the musculoskeletal system, so it was those 2 content areas. Our learning objectives are always embedded in all of our presentations in class. We identify what types of questions we're going to be using. There are lots of different types of multiple choice questions, plus in nursing we have fill in the blank questions and matrix questions and bow tie questions and other things that we can use. We really are very intentional about what level of Bloom's taxonomy we want to focus on, because we need to move them from just knowing and comprehending things to be able to have critical judgment, clinical judgment, and be able to take care of people at the end of their career. We want them to be thinkers. This means we have to ask them test questions that require them to apply and analyze and evaluate, and be very conscious of that as we create our questions. We tell students that this number of points are going to be on the exam, and then the points and what's weighed for different section as well. So this is a blueprint example that we gave out for Module 3 in my Med-Surg course. There were 5 days of content in this. A number of questions were equally spread more or less across all 5 days. It was 52 questions. It was worth 64.5 points because some of those select all that apply or fill in the blank or matching or bow tie questions are worth more than 1 point because there are more data points within that question. Therefore, students should be given more points for answering those correctly, right? So we also tell them to review daily summary slides for more details. Now, summary slides is something that sprang up after I had a classroom visit from Jay Rasmussen. Hopefully some of you remember what an awesome educator he was. I learned a lot from him. And he said that using a summary slide at the end really helps students to see this is how to guide what's really important from this lecture. So all of my summary slides, all the items are here, also listed in my learning objectives, but now I tell them there are 4 questions about types of anemia and related treatment. There are 2 questions specifically about assessment. There's 1 on patient education, etc., so that they have an idea, okay, I need to concentrate my studying on this thing. Medications are always a big focus too in the nursing world, so we tell them these are the meds you're going to see, so you need to know how these medications affect patients, what you expect to see, what adverse effects you expect to see, and what patient education is involved in that. So as instructors, the literature has told us that a minimum number of questions to have a good exam that tests students' knowledge is 50 to 60 items at least to have a high level of reliability. So we try not to have any exams that are less than 50 questions. We also specify how many of those questions are mastery content. Are you guys familiar with that term, mastery content? This is a question that I want everybody in the class to get 100% on. That means this is a key piece of knowledge that everybody should know when they leave this class. So, but we don't want all questions to be like that, but so only 10% or less of them should be that way, but these are big concepts that they have to know as they go forward. We also say on our testing guidelines that we want our percentage right, which would be your desired difficulty, would be, we prefer it not to be less than 30, but the literature says 30 to 80%. If you get too much above 80%, it's usually too easy of a question. So we shoot for that 30 to 80%, but if it gets down to that 30 to 50, we'll talk a little bit more about how we look at those questions. And then just discrimination levels of items. We look at point by serials. I'll talk about those more in a minute. And we also look at the entire exam to see, does the exam as a whole, is it fair and valid and reliable? We tell them, as you saw from the blueprint, of the format of the exam items. They love select all that apply. And those types of questions, but the matrix questions or the bow ties, they know how many to expect then when they see their exam. So best practices for general item creation. We're moving on now from our pre-planning into item creation now. And some of these are pretty straightforward. These were the ones that were across all of the literature from the very different types of disciplines that I studied. So being free of grammatical errors, appropriate vocabulary, avoiding colloquialisms and slang. One of my favorite examples is one time early in my teaching career, I used the word flip-flops in one of my questions, and a multi-language learner had no idea what flip-flops were. So just making sure that you're steering clear of any colloquialisms or slang. We talked about the need to have that higher cognitive level, so you're not testing memorization, you're testing their ability to use that information and make a decision and see things. We want them to use, not all of our questions have a nurse and a patient, or a nurse and a nursing student, or a new grad, so that this is applicable directly to what they're going to be doing when they leave, right? So those clinical vignettes, those scenario-based, this is something also that I did very poorly when I first started is, oh, this is so interesting. Did you know that when they get pancreatitis, they often get pneumonia on the left side? Is that really that important? No, it's not. What's more important is how you treat and care for somebody with pancreatitis. But I shouldn't be testing on those little tiny details. I should be testing about the big concept things. And again, things that are going to help them synthesize and pull together information from all of the other classes they've taken from our wonderful colleagues in psychology or biology or chemistry. Succinct wording and sentence structure is important. Hinged questions means I have to answer a question here in order to get the next one right. So unless it's part of a case study, you don't want to do that because that puts the student in double jeopardy for their questions. So again, hinged questions are questions that rely on answers from previous questions. In order to really have questions that focus on the content and not try to present a type of patient or a type of culture, we want to really abstain from identifying race or culture or gender even unless it's pertinent to the content that is being tested. So something about female types of cancers, I would talk about a person assigned female at birth. So we also want to screen for offensive content, and we in the nursing department, we provide rationale that isn't available to the students necessarily until their review time, why this question is right. And frequently we will put in the page number from their text or refer to a certain lecture content slide so that they know this is what I tested it from. I didn't take this out of something that you weren't supposed to. You're just supposed to know, right? This is something that was part of our discussion in your prep for class. Avoid the use of absolute terms. So that's whenever I tell my students, if you see an always or a never or all or only, that's probably the wrong answer, because I won't use those because that seldom is a true statement. Avoid use items from commercial item banks. If they are in an item bank, the most likely that our students can get a hold of them somehow is pretty high. So we want to have faculty-generated questions in order to make sure we have quality questions. And we also want to make sure that our pool of questions is increasing every year. So the policy in the nursing department is that at least 10% of your questions needs to be changed before the next administration of that exam in order to build a bigger pool of high quality questions and to avoid the ability for a student from a previous class to tell them what's on the exam this time. Looking specifically at stems, stems are best as a question or a partial statement. We want to explicitly state the information you're seeking. And this really goes well with ensure that stems can stand alone. So a really bright student could be able to answer that question or that statement without even looking at the option choices for the answer, right? They should be able to tell you, oh, they're looking for this, and then be able to look for what you want in the actual options there. Write items that only have one correct answer. Nursing students also love, we tell them, what is the best answer? And we'll talk about that later. Emphasize those keywords, right? So if we're talking about things that are a priority, or think what is the best answer, what is the first thing that a nurse should do, we can emphasize those. That helps draw their attention to, okay, what are the things I think about when I think about prioritization, okay? Do not use words like except or not or incorrect. And the rationale for this is because this really our multi-language learners have difficulty with those type of concepts. So make sure you keep everything in the positive. That helps with translation. And for your distractors, all of your options should be grammatically consistent. It's best to arrange them in a specific order, like alphabetically or numerically, so there isn't any, like we noticed one time that almost all of our answers are C. That's not a good idea, right? So let's try and mix them up. Make sure that they're mutually exclusive, and make sure that they're all plausible. And this one is one I have conversations with faculty on a regular basis, is, yeah, you can write a good distractor that's completely false. And that, unfortunately, can lead to false understanding of a content area. So it's much better to give them a true statement that doesn't apply to this situation, a true statement that shouldn't be pulled into this question because it doesn't apply. So otherwise, unless you do a really good job with your exam reviews, you end up having this learning loop that's open and incorrect rather than closing that learning loop. That's right there. Resist presenting, I get ahead of myself sometimes. Resist presenting false information via distractor. And this is, again, forcing those students to pick the best answer as your favorites, right? Yeah. Distribute answers randomly and evenly. Avoid those vague terms. We shouldn't be using words like frequently or often or occasionally, because that is so open to interpretation. It's better to use things that are more concrete. This was a brand new one to me, this idea of using only 3 options instead of 4. My entire studying career in college and my postgrad, whenever I had multiple choice, there's always at least 4. But there are times when, you know what, there are only 3 plausible answers here. So why am I trying so hard to come up with something? Because it's 3 fits. So if you have a distractor that's non-functioning and you only have 3 distractors that are, it's okay. It's okay to only have 3 distractors. So best practices for pre-exam review. We we teach in teams in our department, so we always proofread each other's questions. When I proofread my partner's questions, I proofread them out loud to make sure that we're not missing some particle here or there, or making sure that it makes sense as we say it out loud. That's been really helpful for catching things where when you read it, your mind just automatically puts that in, but if you read it out loud, it really helps to identify those missing words or absent understanding for that question. We also, for our major final exams, ask somebody outside of our team to proof our exam. Because we are so steeped in that content, it's a good practice to have somebody else read it. Read it for understandability. Not only for that, but are there questions at the beginning of the exam that can be answered by somebody at the end of the exam? Because that happens frequently too. So make sure your instructions for the exam are concise, clear, and not open to further explanation. In our testing guidelines, we have designated how the Bloom's levels of taxonomy should. I really can talk about this stuff. Bloom's levels of somebody help me. Taxonomy. Thank you very much. Are addressed across our curriculum. So early in their nursing career here at Bethel, we have more levels of knowledge and comprehension. We have more questions that can be there because this is new content for them, right? But you can see by senior spring, no more lower level or very few lower level questions. We want them all to be in that thinking stage. You need to be able to apply this content to actual patient scenarios. We've had difficulty with pharmacology for years until the past 2 or 3 years when we changed the way we've taught pharmacology. But in order to really bone up pharmacology with our students, we said at least 10% of your questions need to be based on pharmacology if it is applicable for your course. And then alternative format items. This is the minimum number of alternative format items that need to be on the exam because our NCLEX exam uses quite a few alternative items. We want to make sure that our students have practice in working with those types of questions before they actually get to the NCLEX itself. So we use ExamSoft, which is a testing platform, and it allows us to label all of our items. So I can say this is med-surg category renal, this is an application type question, this includes things about an NCLEX category as well. So we label all of our questions, which gives us a good idea then of how our tests are meeting our testing guidelines. So this is an example. Out of this 52 item test, 67% of it was a higher level Bloom's taxonomy, as you can see there. This is appropriate for our juniors. This is the level that we would want to be at for them. So it's appropriate for that audience then. We also have, I talked about the medication requirement in our course, and this one also shows that we meet the 10% of questions. There's actually more than 10% on this exam. And then post-exam review. How many of you pore over those item statistics and take a look at how did each item does? Now, I get a little geeky this way. I got so excited when I learned how to do this, right? And I could spend hours just looking at the statistics, which I never thought would be me. But the statistics tell us what percentage correct the students got, and then your point by serial. And for those of you who aren't familiar with point by serial is what the 27% of the course of this test did well on the exam compared to the 27% who did not do well on this exam. And then you have this chunk in the middle too. So it compares the top 27% to the bottom 27%. And then you get a point by serial to say how well did this question as an item discriminate, that's the right I wanted, between who did well on the exam and who did not do well on the exam, right? So our testing policy states that we need to have a point by serial that's a minimum of 0.15, and the ideal would be around 0.20 or higher, right? So you can see I just chose the first 6 questions of this exam to take a look at how we did here. This one is more than one answer is correct. It's a drag and drop question. So the fact that it got 72% of the students got that one right is a really good percentage. And the point by serial is excellent too at a 0.37. This is a fill in the blank. So again, more than one answer. I'm okay with that 55%, and the points by serial is okay. This one, the point by serial is terrible. What this is telling me is somebody who did well in the exam got that one wrong. But I would want to be tracking this item between exams to make sure that it doesn't consistently trick up a good performer on a test, or if it was just this one person who marked the wrong thing, right? So always boiling down to, okay, what happened with my top performers and bottom performers in this exam? So we want to track these things too. And ExamSoft does that for us. I'll show you an example of how we used to do this on paper prior to this. The thing that we didn't do either very well, I didn't do very well, was track distractor efficacy. So if you have a distractor that doesn't work time and time again, then why is it in there? It's not distracting anyone. So what do I need to do in order to make this a better question to improve that distractor? So you can see that nobody for this question chose B. So I need to look at that distractor and say, has it been chosen in the past, or is this just this cohort that didn't change it? It's good to get at least 50 responses on a 50-question test before you come to a solid conclusion about what to do with that test item. But again, track that distractor efficacy. And then we want to track the whole entire exam reliability. And our department shoots for having a KR20, which looks at the whole entire exam, how well did not just one item do, but the whole exam do on tracking, on differentiating between who is our top performers and our bottom performers. So this exam, we got a 0.82, and our goal is to reach a 0.7. So this exam did a good job of differentiating between our top and our bottom performers. So we're going to use that statistical data to revise those stems prior to the next exam. We're going to use it to revise those item distractors. And then we also are going to look at those questions and say, which questions did my top performers get wrong? And is there something in that question that's making it tricky? Is there a misconception out there that's class-wide? So I need to go back and correct that miscorrection, especially if this happens 2 times in a row, right? Or there's something in this content that they're not getting, so we need to think about a different way to engage them with that content in class so that they can be successful the next time. And those we identify by a low percentage correct and a low point by serial. So when you see those questions, those are the ones that you're automatically going to dig into a little deeper. So this is the question earlier that I showed you. There could be a high percent right. Oh, no, this is a different one. High percent correct, but this is not a mastery item. So I did not identify this in the beginning as a mastery item. So obviously my distractors are not distracting anyone. So I need to either rewrite my STEM or look at the distractors that were not effective and rewrite my distractors. So that's another way to increase the difficulty and increase the validness of a question. And then we look at items with poor point by serials. This one is a point by serial of negative 0.04. 62% of students got this one correct. This was a select 2 question. And then I really want to look at, so my top performers, what distractor distracted them best, right? So my top performers, really whatever this distractor was distracting, and that top one was as well. So does that point to some sort of misconception that my students have, or some way of me not explaining that content well in class? So that can be helpful as well as you think about content for the next revision of that exam. So if you want to increase the item difficulty, one of the best ways to do this is not to provide the answer for them, but then to revise that so they have to interpret something for you, right? So this one gives a good example. They have to interpret the EKG strip. They have to interpret the changes in the patient weight. They have to interpret the vital signs, and they have to look at those labs from that day. And this question asks which of these would be the immediate concern or the immediate thing that the nurse would address. What was the priority here, right? So this completely changes how hard that question is, because it's not going to say normal sinus rhythm, a weight up of this, vital signs this. It makes them dig into that content. This has been a great way to really move a content up on Bloom's taxonomy as well. So before ExamSoft, this is how we would keep track of our KR20 and how we would keep track of the average of the exam and the use of the distractors. This is the point by zero that's here. This is the percentage of students that chose each distractor. So from one year to the next, we would just use different colors and do this. Very arduous. I am so thankful that we have software that does this for us now. But you can see that we did some improvement. Our KR20 went up to 0.7. Our average stayed about the same. So we didn't make the exam any harder. We made the questions better. So it was a more fair exam for our students as well. Have I told you about my new friend AI? I was kind of an AI skeptic in the beginning, but I have come to really appreciate what AI can do for me when I'm thinking about exams and when I'm trying to help students be more successful in being good and preparing for exams and being exam takers. So I enter in detailed prompts, and this was a learning curve. How much information do I need to put into this prompt in order to get what I want? And the more I played with my friend Perplexity, that's the one I like the best, the better Perplexity understood what I was looking for. But I give very specific questions. I want a matrix question, Bloom's level analysis regarding a patient with stomatitis, include medication administration and dietary concerns. And they spit out beautiful matrices. And I'm like, oh, I like this part of it, not that part, but I can change it. Yes?
What is NCLEX matrix?
Thank you. NCLEX stands, she asked what is the NCLEX matrix. NCLEX is the board exam that nurses have to take at the end of graduating in order to obtain a licensure. And it's a national exam, so it's in whatever state they're in. A matrix question is one of our alternative type questions. And that one, so for example, we'll say, is this order from the physician or the provider, is this expected or unexpected or not relevant? And they have to choose, evaluate the order, and then choose. So you can have as many as 4 up to 8, 9, 10 different things that they have to sort in that matrix. That answer your question? Okay, perfect. So I've also given this information to students and said, hey, the best way to prepare for exams is to say, I have to test my knowledge. And the best way to do that is to continually identify those gaps in your learning. So I have provided them with skeleton detailed prompts saying, okay, now you're going to insert this type of disease process, and then we talk about medications, and we talk about nursing interventions, and we talk about patient education. So just rotate these around in these stems in order to test your knowledge, identify those learning gaps. Well, when I did this with a student, her score on exam 2 was in the 70s. She came back on exam 3 and she went from a 70-something to a 91%. And she said it was just all the AI. And of course, that's just one student, so my N is very small. But I would love to do some research on that, right? If we help students become better at pulling in the and testing their knowledge, identifying those gaps in knowledge, they can become better students as well. There's a link to my references there, and this is a Mentimeter with best practices if you want to scan that as well. And I'm open to any questions that you may have. Yes?
I thought early on, I'm trying to think about the connection between discrimination and actually the final grade that the students care about. I thought you said early on that you had this very broad range in your mind of 30 to 80%, correct? But then you showed us an example of a revised useful exam that had an 82% average. Can you say something about how you get an 82% average?
Right, so we're going to have questions. Most of our questions probably are more from the 30 to 90%. The literature talks about 30 to 80%. I'm sorry, I should repeat the question for those of them who are on Zoom and for the recording. Earlier I said that we want questions from 30 to 80% are ideal questions, and that's what the literature identifies. But when I showed you some of my questions with my KR 20, the average was 82, 83% on our exams. So the answer to that is we have the mentality that this is a learning institution. So we have more questions that enter into that 90 than the 80%, so we have a wider range of them, right? If this was a cut exam, meaning if this was an exam like the NCLEX to say you have to achieve whatever percentage it is, then I would want questions that have a narrower, a lower high percentage correct in order to be more discriminative between high achievers and low achievers. But as a learning institution, we want that nice bell curve, right? We want to have those A's, we want to have the B's, and we want to make sure we don't make it too hard so our high performers aren't getting B's. That's so discouraging for students. Does that answer your question?
Yes.
Yeah. Andy?
I'm curious, could you interpret that point by serial number? So I understand that, I mean, the principle you're getting at that, what do those numbers mean? When you say, you get all those numbers, what exactly are they talking about?
Right. I'm always afraid to answer these questions because I'm really not a math person. I just like to look at the numbers, right? So Andy asked, what really does that point by serial mean? And the best way for me to explain it is it looks at this one specific item. It looks at what percentage of the top 27% got that right. And then what percentage of the lower 20%, 27% got that right. And then it tells you it's not item discrimination because item discrepancy because that is a different number. That would just be the number that's the percentage difference between the top. So if it was 93% and 78%, then it would be up 25% if my math is good today. Something like that. You know what I mean? But an item, a point by serial is more of a percentage. So it's a little bit more discriminatory than just the discrepancy between the two. It has another mathematical thing in there, and I'm sorry I can't answer that question more.
So if it's negative, does that mean like the lower students are actually scoring higher than the higher?
That can happen too, right? Negative, so then there'll be like several high achieving students who didn't get that answer right, and several low achieving students who did. And that's always like, okay, something's wrong with this question, right? Did I put too tricky wording in there? Is there something that leads them astray in another distractor that could be correct? Right? Okay. Yes?
I have a couple of questions. The first has to do with the vocabulary, which is unfamiliar to me. Can you tell us what STEM and I think I know what distractor is, but I'm not entirely sure. So
Sure.
STEM and distractor. Define those?
Yep, Rhonda asked what is the difference, what is a STEM and what is a distractor? And a STEM is the question. The STEM is the beginning part of the item, right? So that's your STEM. And a distractor is everything that is except for the right answer in your options.
So the other, all right, got
Yeah.
it. And then my other question had to do with when you're trying to categorize your questions according to the Bloom's taxonomy. Is that always easy to do? I would think that, no, I would think that it would be hard.
Yep.
And that there might be some subjectivity involved, and what is the
Yep.
implication of that?
There's absolutely some. You asked about the how do you discriminate or how do you categorize questions as being knowing, comprehending, applying the different levels of Bloom's taxonomy. And I did find some articles that helped me with that. when I work with new faculty especially, we say, you know what, we just want to make sure it's higher level. So don't worry right now if it's applying or evaluating or analyzing, but just think this can't be comprehending. We want it to be higher. And as they get more familiar, if you have something that they have to analyze, that's more than applying, right? That's more like evaluating or analyzing. So evaluating may be, I have this lab chart that I want you to take a look at, the normals and the abnormals, and I want you to come to a conclusion based on my STEM and the lab chart. That would be a good evaluating. But the good analyzing question would be, let's give you some of the patient manifestations, the signs and symptoms, but not tell you the disease process. And then give you some labs that are going on and some patient statements. And based on all of that, we want to figure out what's the next nursing action to do. So that's a lot more areas of thinking that they have to pull in, therefore making that a much higher level question. Does that make sense? Awesome. Any other questions? Yes?
I think I noticed you didn't have any true-false questions. Do you avoid those?
No, never. No true false questions.
Do they, is there research to
Yes.
indicate that those are unreliable?
Yes, very unreliable, open to interpretation. And they're not fair, they're just not a fair testing. Just one word can make things too off. So everybody says no true false questions at all. Any other questions? All right, well, thank you so much for your time and attention. And if you would like any of the resources, I'd be happy to share them with you. Thank you.